So Rob's right. Well, if I have missed anybody who would like to sort of be acknowledged, we apologize, but we appreciate the fact that all of you are important. All of you count and make a difference, and whether you work in the county, whether you work in government, the economic sector, you're an investor, you're a scientist, or you're a member of our two organizations, we are very appreciative of you being here, and we're glad to welcome you on behalf of New York Medical College. So, on my remarks, I wrote them down in 16 font, which is what I work with now. Just like to, first of all, as I say, welcome you. BioInc was established in the fall, officially, of 2014, so it's really just 2 years old. It's become the fastest growing biotech and high-tech incubator between Manhattan and Kendall Square in Boston. That's an amazing feat. We've really grown so quickly that we've actually almost completely filled our current space, so we're now looking for opportunities to expand our footprint and to bring in additional services, and that's exciting. Designated by the state of New York as the Hudson Valley's innovation hotspot in partnership with ICANN New York, our incubator currently houses 10 clients, with Philips Healthcare Research being the largest with 13 employees on this site. This customized space that BioInc has renovated for Philips' computational genomics team, led by Dr. Nevenka Dimitrov, has been done in collaboration with the Philips group and with Dr. Jay Fallon, who's the chair of pathology at New York Medical College, and Dr. Ira Schwartz, who's the chair of microbiology and immunology at New York Medical College. They are working together and have been for more than 2 years to explore the complex relationship between the human genome, diseases like cancer, and hospital-acquired antibiotic resistance, among other issues that they're addressing. So that work is leading to real improvements, we hope, in not only the science of computational genomics, but also eventually into improvements in patient care. Those improvements in patient care may take place at Westchester Medical Center and its health system, may take place in Boston, may take place around the world. It's that kind of innovation and development that really improves the care of patients, and that's what we're here to foster. It's also consistent with the U.S. government's National Institute of Health Precision Medicine Initiative, the Cancer Moonshot, and the Human Microbiome Project. So we're very pleased to see this important work continue in this new state-of-the-art research venue. This relationship serves the scientific mission that drives the Philips and New York Medical College innovation platforms forward, and it provides great economic impact to this region and to our state. This is an exciting day. Thank you for your continued support. So, I'd now like to introduce the next speaker, and I've just met our colleague, and I can pronounce his first name perfectly, Sri, but Venkatarama is his last name, and Dr. Venkatarama is the Clinical Research Board Director at Philips, and we're very pleased to welcome him here today. And he perhaps will pronounce his name properly and more mellifluously than I did. But please come forward, Sri.
I think he did a good job, saying yourself in the Thank you very much.
And a B.
Thanks for having me. I think it's a great pleasure for me to be here on behalf of Philips. And, my boss will also follow me after I speak or say a few words. I represented a department called Clinical Research Board. The main mantra of the department is to engage in clinical partners, because Philips as a technology company can be innovative in creating new technologies. But people like Dr. Fallon is very key to our success, because he brings the technology to practical usage. He kind of helps us validate. So our department actually engages in key opinion leaders or leaders such as Dr. Fallon and other clinicians around the globe to engage in partnerships that actually results in meaningful innovations, that results in better patient outcome, as well as lower the cost of delivering healthcare in a meaningful way. That's the key sort of takeaway message. This relationship actually started probably 2013, with Dr. Fallon and Nevenka, hashing out how to proceed, and we started with what we call a master agreement between New York Medical College and Philips Healthcare. Started as one project, now we are talking about 5 projects and a fantastic facility such as this one. So I think this is bound to succeed much beyond what we initially imagined, and I congratulate the team here for doing a wonderful job. And I think
thank you.
Hans.
Thank you. Thanks very much. And it's a pleasure to see, as you're seeing today, the initial fruits of a strong collaboration that really did begin 3 years ago and has been encouraged every step of the way. One of the greatest proponents of that relationship is our next speaker, Dr. Hans Alois Wishman, who is the head of Research North America at Philips Healthcare Research. He and I met probably a year ago. We talked about the scientific collaboration, the work plan. I met Nevenka and some of her team members, went to a couple of research meetings and watched Dr. Fallon and her team interact. And I sort of wondered where it was all going to go. And then I met Hans. And he made it clear that this was going to be something that he valued and wanted to continue. And he has been a great supporter of this. So I'd like you to come forward, Hans, and say a few words, if you would, please.
Thank you very much, Dr. Miller. Very kind words from your part. Much more honor for me than I can bear. Very kind of you. Thank you all for coming here and for celebrating it together with us. It's a true honor and even more a true pleasure to be here today and to see this collaboration sort of take this fruit and come to this position. A few years ago, one of our scientists, one of our most passionate scientists, asked the division manager or North America head of research at that time that she wanted to spend a year in Cold Spring. That was the moment where a company like ours, which was known for a particular part of service in the healthcare industry, tried to change the face of what was important to us. It was a passionate drive for changing what we do, how we do it, and with which partners we do it. And I'd like to call her out, Nevenka. Thank you for sort of taking us on that journey. Based on a passionate story of why you wanted to make that happen that you've kindly shared with us a few times. We as a company have been invested into industrial research ever since 100 years ago, just 25 years after founding the company to create the light bulbs, which are now obsolete, and mass manufacture them. And that gives you a bit of a feeling that over those 100 years of research work, we've been changing ourselves, and change has been the only continuous thing that we have. That change we've never been able to do alone. We've been in this area, attached to this area since 1944, when we literally asked a research department from Princeton to move up the Hudson and be in Irvington. We've been in Briarcliff since 1964, and we've established ties in the region that we cherish to the point of saying that once the collaboration between Dr. Fallon, who I'd also want to recognize here as a driving force between in this collaboration, as a wonderful and reliable partner all along. So instrumental in taking a vision that you may have had a decade ago, that some of our team people have shared a decade ago, from an initial research investigation into a first minimum viable product that we dare to take to the outside. With collaborations well beyond research now, but this is one of the areas where we would like to say thank you today for the hospitality, for the environment, for the infrastructure that BioInc represents and that we could leverage in spite of some of the things or the changes that we needed to do. But much more than that, for the wonderful partnership, collaboration all through these years, for struggling with us, for challenging us, for working with us, and for never letting go of that vision that this is something that will be beneficial to patients, to people in the future, because I think that's one of the things that unites us. You as a medical college with a healthcare system, and us as a healthcare solutions provider that we aspire to be, with wanting to make a difference in 3 billion people's lives. We won't touch all the 3 billion in New York State. We will touch them around the world, and some of the stuff that has made it from a research vision, from a joint vision, into a product will really reach out. And it would not have been possible without the kind hospitality, the vision, the stamina, the tenure, the sort of ability to team up and get this done, for which I can only be grateful, and I can only humbly say thank you for helping us all through that time. Thank you for hosting us, and we look forward to the next 10 years of collaboration, if I may say so. Thank you all.
All right, at this point in the program, I'd like to invite one of our leaders, as I mentioned earlier, from the political side of the aisle, Senator Terrence Murphy, to join us. Once again, as we look at all the people that contribute to an environment of success, we must work and do work closely through Dr. Amler and others with our partners in the political realm. And nowhere have we received more support at a state level than from Senator Murphy. So we want Senator Murphy to come forward and make a few comments if we could.
Well, what a great day for New York State, for Westchester County, New York Medical College, and Phillips. This is the perfect solution to the P3s, public-private partnerships. Where Dr. Hans, what you just said about the collaboration of your team working here in New York Medical College, it can't get any better. It just can't get any better. You are in the nucleus of biotech stuff right here at New York Medical College. Dr. Miller, Dr. A, keep up the great work. Because two years ago, I believe there was only one of your incubators was full. Now I believe there's 10. 10. Incredible. This is the cutting edge right here in our backyard. Dr. Hans and Phillips, welcome. Welcome back to Westchester. We thank you for taking the initiative of working with New York Medical College. And Dr. Miller and Dr. A, thank you for all you do of staying on the cutting edge, because this is where the healthcare is going. You are literally going to be saving people's lives with the research. When you go through a tour back here, if you grab a tour, it's incredible. It's absolutely incredible. The nucleus, the brains that are going on back here is just really state of the art. So I thank you. Anything that I could possibly do on a state level, you know I'm all in on that, because this is just the right thing to do. So God bless. Welcome back to Westchester County and New York Medical College. Keep up the great work. Thanks.
And I think just to follow up on what Senator Murphy said, from its humble roots in November of 2014 to today, the BioInc at New York Medical College Incubator includes 10 clients, one of which is Phillips. It has employees, 34 employees working in those companies. It generates great economic impact in a variety of ways in the area, and certainly we view it as being just a start, because we want to maintain that record of being the fastest growing incubator between Manhattan and Kendall Square. To do that, we need to add 10 more clients in the next 2 years. One thing that I will mention as well is that we haven't lost any clients. And I'll introduce you to a member of our management team a little bit later on, but managing the clients and making the relationship special when the companies are so different. Phillips, a massive company with a very strong vision for what it wants to do, and a new startup with 1 or 2 employees just figuring out what to do. We have managers that are able to keep those companies in the incubator, and we haven't lost a company in 2 years. So I think that's an important point to make. So our next speaker from Westchester County, the executive of Westchester County, Mr. Rob Astorino, has always been and continues to be a strong supporter of New York Medical College, and now, like many of you, is becoming aware of the fact that this is becoming a part of the innovation ecosystem in Westchester. So we'd like to bring Rob forward and have him make a few comments.
Well, we are really proud of what's happening in this building. And if you pull back, right, you're looking from the galaxy, and you see this planet Earth, and all of a sudden you start to zoom in on a particular spot. You get to the United States, and we start going up towards New York, and we go right down into Westchester, and right here, this is where, in this county, and in particular this area, which is becoming the hottest spot in America for biotech and life sciences. And we are really, really proud of that. We have 10,000 employees, private sector employees, working in that life science field in Westchester alone. We're very proud of the fact that Phillips has decided to stay and do business and really invent right here in this county. And what's being done back there in those labs, I can't pronounce it, I don't understand it, but it's good stuff. And we're really, really proud that the future of medicine is being developed right here. And so we're grateful. And I just want to tell all the young entrepreneurs and the minds in medicine and life science, keep it up. We're behind you as a county, and we're encouraging you to have the biggest breakthrough in medicine right here, saving lives and changing the world. So thank you for doing what you do. We're really proud of you, and have a wonderful holiday.
Thank you very much, Rob. So before I turn the program over to Ms. Schwartz to close it, I want to introduce her, but before I do so, I want to just mention one or two things. As in my other job, my day job, if you will, I'm the Dean of the Medical School at New York Medical College. 850 medical students in our classes, our 4 years of medical school. Dr. Amler runs another school here at New York Medical College that trains other healthcare providers and public health experts. This building is already part of our educational platform, but I want it, and we all want it, to become part of our innovation platform, because we want to train young physicians and healthcare providers who actually can participate in the next era of medicine, which is going to be precision medicine. We want them to understand how the tools work, what the genome really can mean to them and their patients, and we want them to be able to think and acquire skills that allow them to really figure out how to keep up with those developments in the coming years, because everything is changing. We were talking this morning at a chairs meeting about how if you did a slide deck for a medical student lecture and you made it a year ago, it's already out of date, because things are changing so rapidly. Companies are pushing, like Philips, to bring products to healthcare that will make a difference in the way that we care for patients. When I go to the clinic this afternoon to take care of heart patients, I will be participating in a much different model of care than I would have 2 or 3 years ago, because of companies like Philips and because of great scientists like Dr. Fallon, Nevenka, Dr. Schwartz, and others who work on projects like this. This is the medical school of the future lab. Okay, I've said that malappropriately, but the point of my comment is that we will still have students working in basic science laboratories. We'll still have students wanting to do projects about public health. We'll still have students that want to be part of clinical trials. But the most exciting new laboratory is going to be a building like this, where technology, big data, the ability to use genomic information, and the ability to integrate that approach to thinking is going to make a difference in what they practice when they leave medical school. It is a turning point in this medical college. This medical college is moving into that era, and we are very fortunate to have outstanding partners, whether it's Philips or Regeneron or other companies that we're working actively with. We are going to be part of that educational model. So, having said that, take off the dean hat, back to the program. I just want to introduce another important person on our team, Ms. Randy Schwartz. Randy is the director of BioInc at New York Medical College. She and I work together to help manage clients' needs. I'm more involved in meeting and sort of trying to address their scientific needs and program needs. Randy's involved in making sure that they are well cared for as clients, and as I've told you, we have 100% retention rate. Randy manages the space along with the team of people who are here today, and really does a great job, I think, providing what we call business development services to our clients. Most of our clients, unlike Philips, need management. They need business development tools. They need a CEO eventually. And if they're going to take their minimum viable product, their MVP, to a marketable stage, they need two things: money and a manager. What we're doing is we're bridging them to the phase when they need to hire a CEO. And Randy and I and other people are always talking to our clients, not just about whether they need a new microscope or a new cell culture facility, but also what kind of business development services do you need? What kind of transfer support do you need? How can we help you to do a clinical trial in our new clinical trials unit down the hall? These are the things that we try to do, and Randy's responsible for most of that, so I want to turn the program over to her, and she'll lead us through the end of the program. Randy?
Good afternoon, I'm Randy Schwartz, Director of BioInc at New York Medical College. So I'm pleased to tell you that I am the final speaker of the program. So I'd like to emphasize I will keep my remarks brief. Experience has taught me that it's best to leave your audience before they leave you. So first I want to thank the many people that have made today successful. Sarah Coddett, Dave Bueller, Kelly Phillips and her facilities team, Kathleen O'Connor, Jennifer Rickard, and the rest of the PR team, and all our BioInc clients that have been very patient during our construction phase. So just a quick shout out Conversion Energy Enterprises, 4, Metasprout, Retia Medical, Accent Biosystem, Akiso Therapeutics, Sapiens Therapeutics, and Shy Therapeutics. And from Philips, it was a pleasure to work with Nevenka Dimitrova and Archie Duda and the rest of their team. And from the New York Medical College leadership, I'd like to thank Drs. Kadish and Halpern and Miller and Amler for all their support. And lastly, all the special friends of BioInc. So what our previous speakers have said and what needs to be emphasized is that the relationship between Philips and BioInc is not just unique, it is the face of the future. New scientific developments and advances, coupled with the rapidly changing economic environment, are forcing organizations to rethink and reorganize the way they do business. Successful companies are starting to look at their missions and their objectives to see if they are actually aligned with this changing environment. And one thing is certain, and change is coming. And in many ways, this change is being led by biotechnology and healthcare. The collaboration between Touro University, New York Medical College, Philips, and BioInc is an example of this change in thinking. It is our belief that this new relationship between BioInc and Philips will not only further biomedical science and eventually improve patient health care, but it will also increase employment and further the recognition of Westchester County and the Hudson Valley as centers of biotechnology innovation. This is the future, and we at BioInc are pleased to be part of these efforts. It has to be emphasized that Philips brings a lot to the table. Their expertise in computational genomics, which supports work in personalized cancer care, is changing the way that patient care is delivered. As has also been noted, BioInc, with its parent, Touro University and New York Medical College, also has much to offer. We not only provide the assets of a major biomedical university, but equally important, we provide an environment of innovation, entrepreneurial spirit, and the resources of collaboration, which will further the creation and development of the new thinking, which will define successful organizations such as Philips in the future. BioInc has become a true community resource. Besides providing customized space, business resources, research and development laboratories, we also provide knowledge and expertise of accomplished scientists, faculty, and administrators who stand by, ready to help these startup companies move from the creative and idea phase to reality and success. This new relationship between Philips and BioInc is an example of what can happen when an academic and business communities join together. This relationship is a win-win-win. It's a win for Philips, it's a win for BioInc, and most importantly, for the entire Westchester community. We have great challenges and opportunities ahead of us. Through cooperation, collaboration, and creative thinking, we can make significant contributions. Thank you.
So thank you, Randy, and thanks to all the speakers. And I think that we're now at the point where we can do the exciting ribbon cutting that we've been rehearsing for days, right? No, we haven't, but we're going to try, and we're going to ask all the dignitaries to come forward and stand behind the ribbon, and we'll ask Dr. Senator Murphy, Mr. Storino, Nevenka, Dr. Fallon. Please join us. We want as many people as possible in this shot who contributed to this, recognizing that the frame is only so wide. And Hans, you and I will position ourselves somewhere in the middle, on the other side. And you and I, as I said, this is already a little droopy, but we're going to tighten it. We're going to tighten it.
How's that?
And let's just kind of, as many people as possible, we'll try to. All right, now we won't do anything until we're told. At the count of 3. Hi,
Jen.
Dr. Amler.
all right, everybody should be in shot, smiling, looking excited. Are you going to count,
I
Jennifer?
will. I'm just going to let the flash bulbs pop for a minute.
All right.
All right, ready? 1, 2, 3. Congratulations.
They worked like a charm. As you said they would. Those are sharp. So, well, thanks again. Now, thank you. Another century. Yeah. So today's program, as I said, involves a tour of the facilities. So I think Randy and others will help us to sort of work our way back to the new
I'm
facilities.
going to shout out for Sarah Cowden.
And Sarah will also, I think, be part of the tour. And then obviously help yourself to refreshments because not everybody can go on the tour at once. So we'll perhaps let the first group be this group. Would that be good? Randy, would you lead the group back? And then we'll ask others to go. Yeah, let's do that. Jump in. There we go.
That's what I like to see.